Okay, so assalamu alaikum. Well, in this video, we'll take a look at the muscles of the back. So there are some intrinsic muscles or the small muscles of the back, and there are some large or the extrinsic muscles of the back. So in this section, we'll be studying about the big or the extrinsic muscles of the back. So these are 5 in number: the trapezius, the latissimus dorsi, levator scapulae, rhomboid minor, and rhomboid major. So these are the 5 important muscles of the back which are going to come into your exams as well. और इनके बारे में कहा जाता है that these are the muscles which will be joining or connecting the upper limb to the vertebral column. So as you can see, these are somehow connecting the upper limb to the vertebral column. So इस तरह भी क्वेश्चन आ सकता है that what are the muscles connecting the upper limb with the vertebral column, या क्वेश्चन simply आ सकता है what just name and tell us the innervation and nerve and action and attachments of the muscles of the back, right? So it can be asked in either way. So the first muscle is the trapezius muscle. अच्छा, यहाँ पर मैं कुछ चीज़ों को explain करना चाहती हूँ. First of all, that there's a ligament called as a knuckle ligament or the ligamentum nuchae, which is extending from the base of the skull, and it is attached on the spinous processes of the C1 to C7 vertebra, और उसके downwards ये thoracic vertebra पर continue करता है as the supraspinous ligament. So we should be knowing about this because काफ़ी attachments in ligaments के ऊपर भी होती हैं. So then we just get confused कि क्या है, कहाँ से आया. So this is the ligamentum nuchae, जो कि simply fibrofacial band है, extend करता है from the base of skull. और इस by now we should know that anteriorly किसी भी vertebral column की जो एक vertebrae होती है उसकी anteriorly body होती है, posteriorly spinous process होता है, और laterally होते हैं उसके दो transverse processes, right? So just posteriorly उसके spinous processes पर attachment होती है किसकी, हमारे ligamentum nuchae की, और जो नीचे आके flattened out होकर एक thin सी band बनाता है which is called the supraspinous ligament, right? So we should be knowing about these things. So when you talk about the attachment of this trapezius muscle, तो इसकी origin कहाँ से हो रही है? On the medial 1/3 of the superior knuckle line. So on the back of the head, on the back of the skull, we'll be finding superior and inferior knuckle line. So superior knuckle line से होती है, उसके medial 1/3 से होती है किसकी origin? हमारे trapezius की. Along with that we have on the back we have external occipital protuberance, वहाँ से भी इसकी attachment हो रही होती है, ligamentum nuchae से भी हो रही होती है, C7 spine से भी हो रही होती है, और T1 to T12 vertebrae की spine से इसकी continuous origin हो रहा होता है, right? And also from the supraspinous ligament. So और सारी attachment लेकर ही जाता कहाँ पर, लगता कहाँ पर जाकर. So you can see clearly that ये lateral 1/3 of the posterior aspect of clavicle पर लग रहा है. In addition to that ये apex of the spine of scapula पर लग रहा है, जो हमने देखा था, हमने spine of scapula देखी थी, उसकी root पर जाकर attach हो रहा है, and just like that इसके fibers वहाँ पर जाते हैं. So on the spine of scapula, on the root of the spine of scapula, and on the posterior aspect of the lateral 1/3 of clavicle, we have the insertion point of what? Of our beautiful trapezius muscle. The next muscle is going to be the latissimus dorsi. So this is the latissimus dorsi, a very big muscle, right? So it's getting its origin from the posterior 1/3 of the outer lip of iliac crust. So this is the iliac crust, a part of the pelvic bone, and उसके posterior outer lip के posterior 1/3 से आती है किसकी attachment, हमारे latissimus dorsi की. Along with that it's also coming from the posterior layer of lumbar fascia. So we haven't studied lumbar fascia yet, but you can watch its video on this channel in the abdominal region, वहाँ पे study किया हुआ है इसको. So that's just a lumbar fascia. So lumbar fascia से आ रही है, iliac crust से आ रही है, और कहाँ से आ रही है इसकी attachment? Yeah, it's also getting its origin from the spines, right? So just like we had the attachment of the trapezius, we have the attachment of the latissimus dorsi, पर उसकी attachment थी कहाँ से लेकर आता? T1 to T12 spines. तो यहाँ पर attachment कहाँ से ले? T7 to T12 spines तक, ठीक है? And then also from the lower four ribs and also from the inferior angle of the scapula. So thoracic lumbar fascia, iliac crust, T7 to T12 vertebrae spines, lower four ribs, and from the inferior angle of scapula we have the origin of what? Of latissimus dorsi. और ये attach कहाँ पर हो रहा है? ये we can see that on the bicipital groove or on the intertubercular sulcus of the humerus we have the insertion point of what? Of our beautiful latissimus dorsi muscle. The third one is the levator scapulae, and it is, as you can see, coming from the transverse processes of the C1 to C4 cervical vertebra, and it's getting inserted onto the, as you can see, on the medial border of the scapula, right? So up to the level of root of the spine of scapula. So this is the spine of scapula and this is the root, right? So up till the level of root of scapula, we on the medial border we have the attachment or the insertion point of what? Of levator scapulae muscle. The fourth one is the rhomboid minor. So just like we had rhomboid major downwards, upwards we have the rhomboid minor muscle getting its insertion from the lower part of the ligamentum nuchae and also from the C7 and T1 spines. बस छोटी सी जगह से इसकी origin होती है, and then it gets inserted onto the root of the spine of scapula, right? And then we have rhomboid major getting its origination from the T2 to T5 spines of thoracic vertebrae, and it's getting inserted onto the medial border of scapula just below the root of the scapula, right? So in this way we have the attachments of each of the muscles of the back, each of the important muscles of the back. And now we're going to look at the nerve supply and the action of each of these muscles. So trapezius is getting its insertion from the spinal part of accessory nerve. So basically we have 12 cranial nerves, C1 to C12, right? And the 11th cranial nerve is called as accessory nerve, right? So उसका spinal component और एक है उसका cranial component. So cranial component तो definitely brain से related है, but the spinal component will be innervating the trapezius muscle in this case. So the spinal component or the spinal part of accessory nerve will be innervating the trapezius muscle here, and the latissimus dorsi is innervated by the nerve to latissimus dorsi assembly of thoracodorsal nerve, a branch of the posterior quadribrachial plexus, right? So then the levator scapulae and the rhomboid major all are getting innervated by the dorsal scapular nerve. So rhomboid descend हो रहा है तो dorsal scapular रख सकते हैं that it is innervating all of these three muscles. So in this way it becomes easier to remember the nerve supply of each of these muscles. So action ये है कि trapezius is a shrugging muscle, so it will be elevating the shoulders, and along with the rhomboid it can cause the, you can say, the retraction of scapula as well, and it can just you can say steady the scapula. So latissimus dorsi is called as a climbing muscle, so it will be helping in the adduction, extension and medial rotation. वही एक्शन जो स्विमिंग में यूज़ होते हैं, ठीक है? सो स्विमिंग में, रोइंग द बोट में, क्लाइंबिंग में, और यू नो सच एक्शंस रिक्वायर्ड द latissimus dorsi muscle, and also in forced inspiration, उसका भी एक मसल इंपॉर्टेंट मसला है ये, right? Oh sorry, violent expiratory effort, not the inspiration but the violent expiratory effort में we need the latissimus dorsi. So levator scapula, as the name indicates, it will be elevating the scapula, right? And the rhomboid major and minor will be retracting the scapula just along with the trapezius as well. So these were the important muscles, उनके attachments, उनके nerve supply और उनके actions. So I hope it was helpful for you. Thank you so much. Allah Hafiz.